AI, behavioral science, and digital communications are transforming how patients interact with the system. But are they actually improving outcomes or just adding noise and costs? Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the Health Biz Podcast, where I interview top healthcare leaders about their lives and careers. My guest today is Bob Farrell, CEO of mPulse, a healthcare engagement company that leverages conversational AI, behavioral science, and multimodal communication to improve patient outcomes and health literacy. Do you like this show? If so, please subscribe and leave a review. Bob, welcome to the Health Biz Podcast.
Thank you, David. Good morning.
We're going to talk all about what you're doing now, but I like to wind the clock back to the beginning and ask about the olden days and ask about your background, your upbringing. What was your childhood like? Any influences that have stuck with you throughout your career?
Yeah, I had a very interesting childhood in that early on I had the opportunity. My dad was an expatriate in Iran, and we lived in Tehran for 4 years when I was in my formative middle school years. And um, a lot of the things that I experienced during that time, I think, made me very non-ethnocentric and aware of what's going on in the world, and that's kind of helped me in my career quite often.
That's an amazing background. I grew up in Washington, D.C., just outside in Bethesda, and so there were people from all over the place. And in 1979, I was 12 years old, and there were a number of Iranians that came in during that time frame. And just before that, Vietnam War ended, and there were a lot of people that had come in as well. So you really got to see from a little bit different perspective, not as direct as what you saw, but I can imagine that could be quite formative and open up your horizons.
I think when you have a lot of diversity early on in your life, it makes you aware of the different constituencies that you need to deal with in a business life, which can be really helpful.
So, what did you do for education? Did you move around when you were little, or go through high school elsewhere? Or were you in the states?
No,
Or
after we returned from Iran, I went to high school on Long Island. I went to college and in Stony Brook, which is also in Long Island, and I did have the opportunity in my career to travel quite extensively, and early jobs had me spending extended time in Asia and in Europe, and I think all of those things contributed to the experience that I was able to bring to the different CEO roles that I've had over the years. This is my fifth CEO role, and with each of them, I've been able to sort of build on the last one and hopefully forget about the things that didn't work well, or take lessons from those and focus on the things that did work well and take those to the next level.
that's good because sometimes I find that maybe the brain does this by itself, but someone will ask me about some previous unpleasant experience or something. I kind of repressed it somewhere. I can't remember the people or whatever, but hopefully I've built on it as opposed to just being obsessed with it all the time. But give us a quick a quick run through of this career progression and various CEO roles that you had taken on. And I saw also, I think, some work in private equity, both I think in the firm's end as an operator.
Yeah. So as I mentioned, I've been a CEO 5 times, and my first CEO role was with a company called Metastorm, which was a business process management software company. It was a great opportunity for me to jump into something that was relatively small. We grew it fairly significantly to over $100 million in revenues. It was a great company, though, in that it really automated, managed, and controlled mission critical processes with software, and really took workflow type things to the next level. And I've been able to parlay that into a bunch of other roles. Most of my CEO experience has been with software and technology companies, and along the way, I've worked with a number of private equity firms, as you mentioned, and have helped those firms do some things with their portfolio companies along the way. And, private equity often gets sort of a bad rap, particularly when you bring it up in customer settings. Private equity that I've worked for has been great. It really has provided the capital necessary for the companies that I've worked with to drive innovation, to drive growth, to help people's careers get progressed, and to serve customers really well. So I jumped into this role here in mPulse in August of 2022. And prior to that, I had worked around healthcare as a vertical in software businesses. This is my first time being squarely in the healthcare space. So it's been a little eye-opening in many ways, and exciting in many ways.
So with my first question related to mPulse, you kind of anticipated it, is about why get into healthcare? Because when some people say they work their way around healthcare, like I know some people that say, yeah, they work their way like everywhere but healthcare to stay the heck away from it because it's not, it has its own challenges. So why is it just that this seemed like a great company and a good spot to pull out your CEO experience, or was there something about healthcare that made you interested in it?
Well, as a business, there was definitely a clear opportunity. One of the things that really attracted me to the company for the first time in my career was an opportunity with a business where we're genuinely helping people every single day. And, you talk about different bottom lines. Here at mPulse, one of the key elements to our bottom line is what statistics do we have to prove that we're improving the healthcare outcomes of people on a daily basis. And we are doing that for millions of people. So that was a big attraction for me, independent of the technology, independent of the domain expertise that we had in the company, which were all great. But this opportunity to, to have some passion around actually helping people is really been an attraction for me.
So I'm sure every industry has its own jargon and things that it focuses on. In healthcare, one of those is this concept of patient engagement. Well, first of all, the idea of the patient as opposed to customer, but patient engagement. What is that anyway, and why does it matter? Or I assume it does matter.
Well, it does, and we combine patient engagement and member engagement sort of into the same genre. And you mentioned the word customer, and one of the things that I learned when I got here was that the healthcare industry does not often treat patients and members as customers. If you look at financial services, if you look at e-com, you look at supply chain, a lot of other spaces have really engaged their customers digitally, using lots of modern techniques to create detailed personalization and great experiences. Healthcare was a little behind in its adoption of those kinds of technologies and still is behind. And some of that has been driven by regulation, but some of it has also just been a slower technological adoption rate within the healthcare community. So, we're focused on the health consumer journey and the different touch points along the way across different populations to really help consumers, members, patients take charge of their health and do the things that they wouldn't otherwise do because they're not aware of what they should do or not educated enough about the things that they know they need to do, but they don't know how to actually go about doing it.
So I always hear there's a lot of barriers to effective healthcare communication, and these have been, going on for some time. Now there's new technologies that are out there. So what kind of barriers do you see, and how is technology helpful?
Well, one of the barriers, unfortunately, is regulation. And when you look at the TCPA, the Telecommunications Protection Act, it is been designed to protect the privacy of people, which of course we all agree with and understand. But when it comes to healthcare, it can limit what health plans in particular can do with texting and IVR and email outreaches. And there is a carve out for that for healthcare, but there's some significant changes to that regulation coming, and it puts some of these providers and health plans at a disadvantage in being able to use all the channels available to them to go get access to their members. Now, listen, nobody wants unwanted text messages or unwanted phone calls and whatnot. So you need to manage it in an effective way, and we can use technology to manage consents, manage opting out in a way that the right messages get to the right people through the right channel for the right reasons. And that's what we're trying to balance with the programs that we have.
And so you think about, AI, generative AI in particular, automation, things that are all over the place. And are those having a big impact on, patient provider interaction? And as we look at the potential of the technology and where it can go, there's obviously some pluses. Are there any downsides?
Yeah. So I would say that less than generative AI, conversational AI has really played a role in engagement, and in particular, the ability to have these two-way communications where um, a health plan or a provider reaches out to a member or a patient for something specific, and through conversational AI and using NLU, you're able to help determine what the next best action is. So rather than leaving a member or patient hanging, you can continue the conversation in a way that ultimately leads to them doing something, whether that's arranging for breast cancer screening or getting a flu shot or making sure that they're adhering to their med programs, whatever the use case might be, that using AI in conjunction with NLU to really master the next best action is important. And sometimes with certain populations, um, it's difficult because the simple reason they may not do something is because they don't have transportation or they don't understand it, and we can use AI then to help provide them with the right content to get them familiar with whatever the situation is that they're dealing with.
And Bob, just to clarify, I'm guessing that NLU is natural language understanding as opposed to NLP, natural language processing. Is that fair? Is that right? And if so, what does
That's
that mean?
right. Yes, that's right. And sorry for the I jumped into jargon there.
That's all right. You got to get those TLAs, 3-letter acronyms. So that's a good one. Good. So how about behavioral science? So I've seen you dealing with people and when they're dealing with a health condition, it's an area where it's not as so straightforward as, buying something at a restaurant or something on the logistical side. What kind of impact does behavioral science play in terms of if you want to impact outcomes, which is what we talked about up front?
Behavioral science plays a big role in helping improve outcomes, and it can be as simple as just looking at the words that are used in a text message to make sure that you capture the person's attention and give them the right call to action without them even realizing it. And that's not suggesting that it's done in an inappropriate way, but the selection of the right words is really important. Understanding your population and using behavioral science to augment words with photonovellas, essentially comic strips, or video clips or audio clips to help move people to the right action is really important. So we put together in our behavioral science practice the use of all different forms of communication to help lead people the right way. And if you don't stop and think about it and craft messages and craft interactions and build workflows with behavioral science in mind, the results just aren't going to be the same. And we've seen dramatic improvements in engagement results when behavioral science has been applied effectively.
When we're talking about technology, we're talking a lot about information technology. We're talking about AI, automation, but there's another technology that's had a big impact in healthcare. And I think the impact is just starting to be seen. And that's a drug technology. I'm thinking about GLP-1s in particular. And I'm wondering whether the blockbuster success that you've seen with the GLP-1s, is that having an impact in your world?
Yeah. So, in our business, one of the things that we've done is to, work with the RX side of health plans as well as drug manufacturers themselves. We have a number of large pharma customers to make sure that they are deploying messaging around whatever their product is appropriately and in a way that helps people identify interactions that could be dangerous or otherwise generating unintended outcomes without allowing the engagement to be used for people to get access to things that they really shouldn't be getting access to.
Got it. Now, one of the advantages of coming into healthcare after a career in technology elsewhere is, as you said, healthcare often lags in technology, and there's some reasons for it, some good reasons, some less good reasons. But are there things that healthcare can learn from some of the non-healthcare businesses that you've been involved with and that you're able to bring to it now?
Yeah, absolutely. I think, when you think of digital engagement and advanced personalization, um, I think there's a lot that healthcare can learn from how, for example, financial services have engaged with their customers, in the case of healthcare members and patients, um, and have really helped them orchestrate a journey. So if you think about the journey that any health consumer is going through, there's a lot of stops along the way. There's a lot of different things that have to happen at different points in people's lives. You're going to engage with somebody who's aging into Medicare differently than you're going to engage with a new mother. Um, and the same thing happened with financial services. When you're planning for retirement, it's one set of interactions and engagement. When you get to retirement, it's another set. And so looking at how you can use technology to really manage the points along the journey the right way at the right time, I think is something that healthcare can pick up from how other industries have used technology.
One of the challenges in digital health, and this is a longstanding challenge, has been about reimbursement. And in fact, when digital health started, and you had some things like doctor-patient emails and web-based communications, one of the concerns was, hey, this is going to be like the phone, which was something that was theoretically reimbursable, but practically wasn't actually going to be reimbursed. In terms of reimbursement challenges, have those been solved in digital health, or are there still challenges related to reimbursement?
I think there's, inherent in your question was part of the answer there. There continues to be, a lot of challenges around how technology can be leveraged appropriately to improve reimbursement. Um, and I think I haven't been around detailed healthcare for as long as you and others, but in the number of years that I have been here, I've seen great improvements already happen. And I think that the great equalizer around all this is data, and having the right um, data lake, if you will, and opportunity to connect the dots between all the different uh, pieces of what makes reimbursement work well and effectively and appropriately. Um, Great strides have been made there. And I think perhaps if we look at where AI could be deployed in the future, once this data is there, once the LLMs are at a point where you can use them in a way to drive reimbursement appropriately, we'll see some greater leaps in progress.
Now, when I first heard of mPulse, I remember I think it was called mPulse Mobile. If that is that right, and if so, why drop the mobile?
Well, the short answer is I don't know why mobile was ever on that on that name and nameplate. When the company first got its start, it was really focused on sort of this simple messaging around particular use cases on mobile devices. So it was kind of a part of a startup name, and as the company has evolved, and today we have a value proposition that is focused on all things health experience and insights. And having mobile as part of the name doesn't really do justice to the breadth of our overall value proposition.
I guess if you ask somebody where it went, you could say, well, it's contained in the small m at the start of the name anyway. So
Yes.
you could have it. So let's talk a little bit more about AI. I'm interested in about how AI. You mentioned conversational AI and kind of corrected me when I said generative, but the conversational AI. How using AI today? How are the clients using it? And where is it going? Because I see you've set up, I think, a kind of AI center of excellence. So how do you see it both today and where it's going, and to what extent can you actually anticipate where it's going, or more just you want to be positioned so that you learn from it and incorporate the lessons that you do learn?
So we're using AI as I mentioned, conversational AI in the engagement side. We also use AI and machine learning on within our predictive analytics capabilities, and um, that both of those things have been part of our business for many years, really from inception. And um, one of the things that has happened as generative AI and the overall AI excitement in the industry has gotten more significant. Um, a lot of our customers are as soon as they hear AI, they throw us to a group that is focused on making sure that we're using AI appropriately, making sure that we're not making decisions around clinical care or anything like that with AI. So the reason we created this AI Center of Excellence was really to make sure we had a governance vehicle in place to make sure that we were using it appropriately and that we were driving innovation, but not letting innovation get ahead of regulation and ahead of where our customers felt comfortable deploying AI. We've recently introduced something called a trust portal where we've encapsulated all of our AI techniques, um, everything around what we would need to be compliant with a customer's views around AI into one place. Um, Customers are excited by it and scared by it at the same time, and we're trying to bridge that gap for them and make sure that we continue to move AI forward, but not in a way that um, uh, gets in the way of companies' desire to make sure they're governing it properly.
I know we'll be talking about AI in healthcare and elsewhere for a long time. I'm wondering if we look just a little bit ahead and say, what are some of the next frontiers in healthcare communication? Voice AI? Is it wearables? Is it something else? But if we look a couple of years ahead, what will we be seeing that we don't currently see?
Yeah, I mean, some of those things are here today, and I think it's like how do wearables, how does the data from wearables, find its way into um, the ability for AI to leverage it to um, provide prevention of at-risk populations. I think we'll see a lot of we're working very hard to um, look at-risk populations, use data, use AI to create engagement programs that engage those at-risk populations earlier in the game. So we use our predictive analytics to determine who they are, we engage them, and then drive them to some certain actions. So I think we'll see technology more in a more streamlined way, helping patients and members take action long before they have a problem, or in a way that allows them to deal more effectively with a problem in a more timely way. Um, Help them become more educated about whatever it is they're dealing with. So much of what we do is on the awareness front and having people aware of what they're dealing with and educated about it, whatever kind of population they're from, whatever kind of language they speak, wherever they live, is really important.
There's a new administration in town in Washington, D.C., and it's a lot of things have happened pretty quickly. As you look ahead, what do you expect the impact to be of whatever may be happening in DC, and what's your plan to prepare for that and to react to it?
Certainly, the new administration has created a lot of uncertainty. Um, Many of our customers are Medicare and Medicaid related customers, and um, they're trying to navigate the landscape and determine how they can be as ready as possible for whatever may come down, whenever it may come down. Um, I've, in the last 2 weeks in particular, have been out on the road meeting a number of our customers for a variety of reasons, just to make sure we understand what's going on in their businesses. And I think they're very focused on making sure that they can continue to serve their members in the best way possible, particularly health plans. Um, and they're looking to us to make sure that we can get out ahead of the curve and have the data necessary to make sure that they can continue to do that. Um, It's difficult to plan beyond that because of uncertainties. And I think being in a state of readiness is crucial to what you can do right now.
My last question for you, Bob, is if you've read any good books lately, or at any point in time, anything you'd want to recommend for our audience.
Well, there's a book that I read a long time ago, and I keep it here in my office and refer to it often. And it's a book by Andrew Grove, who was the original CEO of Intel, called Only the Paranoid Survive. And I'm always looking behind me, always looking over my shoulder. Much of what we're talking about, will be disruptive in certain ways. So how do we make sure as a business we're part of the disruption and helping our customers navigate that disruption? How do we make sure that technology doesn't get the better of us and put us at a disadvantage? So all the principles in that book continue to be applicable. And if you haven't read that book, I suggest you go out and read it.
Good. It is a well-known book, and I've done hundreds of podcast episodes and no one's ever recommended it before. So they should have, but I'm glad that you put it out there. Well, Bob Farrell, CEO of mPulse, thank you so much for joining me today on the Health Biz Podcast.
Thank you, David. Have a great day.